Good morning, all. This is Indra here. So, we are going to discuss a topic in the medical electronics subject. The course objectives are given as below. The course outcomes are also listed here, which we have discussed already. And the textbooks are as listed in the slide. Now, we are into Unit 3, which talks about modern imaging system. Today's topic for discussion is endoscope. You all know, or you might have heard, what an endoscope is because some of your relatives or your friends would have undergone an endoscopy for some difficulties. So, the picture shows an endoscope. So, this is a medical device which has a light attached, and this device is used to look inside your body because the medical physician or the practitioner can look only from external view. To know what is happening inside, we need an instrument like this. So this particular instrument is inserted through a natural opening like your mouth or through the rectum. So when you do a medical procedure with any one type of endoscope, that medical procedure is called as endoscopy. Hope you are all clear what is an endoscope and what is termed as endoscopy. Moving on to the next slide, this is a simple figure wherein an endoscopy is shown. That is, a type of endoscopy is shown. This is EGD, which is nothing but esophagogastroduodenoscopy, which means through esophagus you insert your scope. This is your endoscopy. So this is your endoscope instrument. It has a light. It is inserted through the mouth. So here we have food pipe, which is called esophagus. So you see the black color wire, it goes inside and up to stomach and up to intestine it travels. So this is called a simple type of endoscopy. So endoscopy is nothing but it is a procedure which is done to examine structures that are inside your body. So during the procedure, the healthcare provider or the person who does the endoscopy, he will place a long thin tube inside your body until it reaches the particular organ which they have to check. It may be your stomach, it may be your intestine or whatever it is. So they have a light with a special camera at the end. So the scope is nothing but the instrument at the tip, right? So it tries to capture the image or the videos of the organs or any other part you desire. So what happens is this is connected externally through a screen wherein your healthcare provider will see what is shown by that endoscope. So in parallel the display is seen. There is an advanced terminology called capsule endoscopy. As the name indicates, the endoscope is packed inside a capsule just as medicines are packed. It involves a wireless camera. This is a recent trend. So there is a wireless camera inserted. So that camera can be fitted inside a capsule. Looks like a vitamin tablet, right? So what happens is that you have to swallow this tablet. When this capsule travels through our digestive tract, it takes thousands of pictures which are then transmitted to a device which is attached to our wearable belt in the waist. You will see the picture in the next slide. So what happens that the advantage of this capsule endoscopy is it can travel till the last small intestine, because through a normal endoscopy or a standard endoscopy, the small intestine is very difficult to capture. So using capsule endoscopy, you can image the small intestine also. So don't worry about the capsule. It will pass out of the digestive system within 24 hours to 48 hours. So now you see the picture of the capsule endoscopy. Okay, so this is a picture wherein you see a person. He is undergoing the procedure, and definitely you need to have fasting before the endoscopy because you swallow some tablet. The tablet with a camera travels through the food pipe, stomach, intestine, etc. So it has to be clear so that it takes a clear image. So I have to be with fasting on the prayer day. The capsule will slide smoothly through your digestive tract. The third step is I'll have a belt which I'll be given prior swallowing. It will be around my waist. What happens is that when the capsule with the camera goes along the digestive tract till the intestine, all the signals that are transmitted will be received by the receiver which is placed around my waist. So what happens after the final process, the capsule will be naturally excreted outside. You can see all the parts of the human body, which is stomach, colon, small intestine, rectum and the final small intestine. So the capsule, as you see here, it looks like this. First one is battery because it has to be self-sustainable. It has a transmitter and receiver antenna. There is a chip which can store even the images. LED lights are there to show the path because inside your body it will be dark. There is a lens which is of course the camera's lens. So the advantages are it is without any pain. There is no need to give any sedative. You can give direct 3D images. You can make an accurate diagnosis. So the size of this capsule is 27 mm, which is barely 1.2 inch. So this is advanced endoscopy which is now being practiced. Hope you all understood about capsule endoscopy. Moving on to the types of endoscopy, there are n number of endoscopies which are used for diagnosing different problems at different parts of your body. As you can see, there is anoscopy, arthroscopy, bronchoscopy, colonoscopy. Anoscopy, as the name indicates, any problem in your anus and rectum can be seen through it. Arthroscopy is to know about your arthritis. Bronchoscopy is nothing but to see your windpipe and your lungs. Colonoscopy is to scan your large intestine. Cytoscopy is nothing but to see your urethra and your bladder. Enteroscopy is nothing but to look into your small intestine. Esophagogastroduodenoscopy is nothing but, as we have seen earlier, it is upper endoscopy wherein your esophagus, stomach and the upper part of the intestine is being scanned. Hysteroscopy is nothing but to look into your uterus, you scan through the vagina. Laparoscopy is another type wherein your abdominal and reproductive organs are looked into. Laryngoscopy is nothing but, larynx is voice box. So if there is any problem, I can scan through your mouth or nostril to see what is the problem. Next is mediastinoscopy. It is nothing but it will have an incision at your breast and the wire goes inside to see your heart, esophagus and windpipe. So these are the different types of endoscopies available as I already mentioned. There are further types which is neuroendoscopy. As you guess, it is for the brain. Proctoscopy, it is again for anus and rectum. Sigmoidoscopy, it is for colon and rectum. So there are n number of endoscopy procedures available which help medical practitioners around the world to exactly diagnose the problem. This is thoracoscopy wherein your thorax, diaphragm and other parts are being studied. Next is ureteroscopy, as it is said, kidneys to your bladders, that is being checked. And what are the applications of endoscopy? As we discussed, digestive system. If you have any digestive problem like gastrointestinal diseases, colon cancer, etc., you can easily diagnose with it. Similarly, for head and neck, if you have any swallowing disorder or laryngitis, I can check through it. Similarly, for testing your joints also, I can check it. Similarly, your brain, if there are any tumors, I can also see it through this endoscopy. And in respiratory system, mainly for finding out lung diseases and infection, it is very useful. When you go to urinary system, if there are any infections, if there are any stones, this endoscopy helps me. When you go on to the reproductive system, if there are any abnormal uterine bleeding or endometriosis, fertility issues, I can easily diagnose with the help of endoscopy. So we should say that this is a very good medical procedure which helps every medical practitioner to know the inner problems of the patients. That's all for today. Thank you.